So you've tested positive for syphilis. Let's talk about your next steps. Let's start off with some basic syphilis information. Syphilis is a bacterial infection that can be passed on through oral, vaginal, or rectal sex. Transmission can also happen by coming into direct contact with an open syphilis sore. There's nothing shameful in testing positive. You should know that you took a great step for your health by being tested. Syphilis has 4 stages through which it can progress if it's left untreated. Common symptoms typically depend on the stage. The first 2 stages are the most common. People might experience a singular or multiple sores, typically found at the site of transmission. A rash, primarily in the abdomen, can also appear. Both the sore and rash typically don't cause any pain or discomfort, and the rash can also spread throughout other parts of the body. Abnormal discharge and flu-like symptoms can also be present. The other 2 stages are more rare, given that routine testing catches an infection early on. Now let's talk about the difference between a rapid and confirmatory test. Rapid tests or point-of-care tests are very accurate tests that are used as preliminary to screen for infections. If you have tested positive for syphilis in the past, it's not recommended to use rapid tests moving forward, given that they will always come back positive. These tests detect antibodies, so they won't let us know if there's an active infection in the body. If you have a rapid reactive test, like the ones done here at HeyDenver, your next step is to get a confirmatory test. The term reactive is used instead of positive with rapid tests, since these are seen as preliminary tests and further testing is needed to confirm an infection. Receiving a reactive rapid test result can be scary and sometimes shocking. Knowing information about what the infection is and what your next steps should be can help alleviate some of those feelings. Since syphilis is a bacterial infection, it can be cured. A syphilis infection is cured using penicillin, prescribed and administered by a healthcare professional. The stage of the infection will dictate your dosage. After completing treatment, your provider will let you know for how long to abstain from sexual contact in order to prevent reinfection. People who have been treated for syphilis should abstain from sexual contact until any open sores completely heal. Your provider will recommend retesting after completing treatment to ensure that the treatment has done its job. They will let you know how soon after to retest. Telling a partner that you've tested positive for an STI can be scary. It can also seem very daunting. We always encourage open and honest conversations. Tell your partner to get tested for syphilis, and always remember the window period. For syphilis, it's recommended to wait 3 months after a sexual encounter in order to have an accurate test result. Or let them know to get seen by a provider if they start experiencing symptoms. Keep in mind, testing positive for an STI doesn't always mean that someone has cheated or that your relationship has ended. Your safety always comes first. If you fear that your partner might hurt you, it might be better to send them a text, an email, or to tell them through a phone call. You can also send your partner this video. If you need a list of places where to access treatment or to get tested, check out our description where you can find a list of clinics in the state of Colorado where you can get those done.